A claim can be brought on behalf of a child who has been injured at birth if it can be shown that the standard of care received was below the standard to be expected of a competent obstetrician or midwife, and that the substandard care caused the injury. In other words, we must show that had adequate care been received, the injury would have been avoided or materially less severe. To investigate a claim, the first thing we tend to do is obtain and review medical records. If, after review of the records, we consider there to be reasonable prospects of success, we will apply to the legal aid agency for funding. This enables children to keep 100% of their compensation if their claim is successful. Once funding has been set up, we ask medical experts to review the records and provide reports. In a typical claim on behalf of a child who has sustained brain damage at birth, for example, we are likely to instruct experts in obstetrics and midwifery to comment on the standard of care both mum and child received during the pregnancy, labour and delivery, but also experts in neonatology, paediatric neurology and neuroradiology to comment on the likely cause of the child's brain injury and to determine to what extent that injury is likely to have been avoided or materially less severe had adequate care been provided. It is a detailed process, and I'm often asked how long a claim will take. Every claim is different. Sometimes the hospital trust will admit liability early on, and sometimes they don't, and these claims can take longer. But on average, I would say that a typical claim takes around 2 to 3 years before we settle liability. And it is at this point that we can request an interim payment of compensation. This is a chunk of money that can make a real difference to a child's life and might be used to fund respite care, adaptations to the home, or equipment and therapies. After that, we will start to investigate quantum. This is the process in which we work out how much money a child will need for their lifetime as a result of their injuries. And again, this can take another 2 to 3 years to complete. But by this time, the child should be benefiting from the interim payments, so things should be significantly easier for families at this point. It's a long process, but families often say how helpful they find it to have input from some of the country's leading medical experts, advising them on what is best for their child. There are time limits on bringing a case to court. Generally, for adults, this is 3 years from the date the negligent treatment occurred. But for children, this 3 years doesn't start to run until their 18th birthday. So for children who have been injured at birth, they will have until the day before their 21st birthday to issue their claim at court. Many of our clients do not have the mental ability to manage their affairs or finances in adulthood, and they are described as lacking capacity. Whilst a person lacks capacity, time limits do not apply. But regardless of time limits, I would recommend seeking specialist legal advice at the earliest opportunity, whilst memories are still fresh and medical records and other forms of evidence remain intact. Our experienced team are recognised specialists in the field of birth injury and recover millions of pounds for children and their families every year. This money can make an enormous difference in a child's life, providing the care, equipment and therapies they will need for a lifetime. And for parents, the reassurance and peace of mind that their child will be looked after even when they're no longer able to look after their child themselves. So if you're thinking about exploring a claim for your child, please do get in touch. We'll be with you every step of the way.